Currently, there are no evidence-based guidelines for management for traumatic grade 1 or 2 splenic injuries with active extravasation on CT scan. Previous studies that have demonstrated high failure rates of observation in patients with active extravasation and splenic injuries have been in patients with splenic injuries of grade 3 or higher. Embolization of all patients with low-grade splenic injuries with active extravasation could lead to immunologic insufficiency without benefit. The purpose of this study is to determine the incidence of medical management failure of grade 1 and 2 splenic injuries with active contrast extravasation in the hemodynamically stable patient. Because the incidence of grade 1 or 2 splenic injuries with active extravasation is low, we are recruiting institutions to participate in a retrospective observational study to determine the failure rate of observation in these patients with low-grade splenic injuries and active extravasation. The inclusion criteria include patients 18 years of age or older, grade 1 or 2 splenic injuries secondary to trauma with active contrast extravasation on CT scan. Exclusion criteria include hemodynamic instability and patients on anticoagulant or antiplatelet therapy. Our primary outcome will be failure of medical management requiring angioembolization or surgical intervention. The secondary outcomes that we will be evaluating in our study are mortality, length of stay, ICU length of stay, and transfusion requirements. If you wish to participate in this study, please go to the East Multi-Center Trial homepage and fill out the online center sign-up form.